Good morning. My name is Kelly Trudell. I'm the Director of Business Development here at She & Finney, and it's my pleasure to welcome everybody this morning to our program, Can Employers Require Their Employees to Get the COVID-19 Vaccine? Just a quick few housekeeping items. This program is being recorded, and we will post the slides as well as circulate them to all attendees later today. It will also be posted on our LinkedIn social media. Please post your questions using the Q&A tab at the bottom of your screen. Our presenters will do their best to address as many questions as possible. I would now like to introduce our speakers. Jay Gregoire is the chair of the Healthcare Practice Group, and Jim Reedy is the chair of our Labor and Employment Group. Jay will start the discussion now. Thank you.
Good morning, everybody. Welcome to the webinar. We have a lot to cover today. I'm Jay Gregoire, as Kelly discussed. I'm here with Jim Reedy. We're pleased to be here and pleased you could all attend. We're going to jump right into the agenda because we only have 30 minutes. We will stay on for questions afterwards, but a lot to talk about today. So first, we're going to talk about an update, just update you on the virus and vaccine distribution in New Hampshire. Then talk about the $1 million question, can employers mandate the vaccine for employees? And we'll talk through the different types of employers and how that answer to the question differs. We'll talk through consent requirements. We'll talk through what if an employee objects to the vaccine due to medical or religious reasons. We'll explain some alternatives to consider, best practices, and then move into the Q&A. Okay, so as many of you know, COVID-19 infections are through the roof these days. Unfortunately, hospitalizations are rising, deaths are rising nationally and here in New Hampshire. The last I checked, which was this morning, there was 261 current hospitalizations, 656 deaths, and about 36,000 cases of COVID in New Hampshire. As you know, over the summer, a lot of states started to roll back their standards and relax them a little bit, but as the cases have increased, states have ramped up their protection efforts. In New Hampshire, we had a mask mandate, and other states have been moving into lockdown mode. So things are getting more restrictive, not less restrictive. At the same time, as a number of the vaccines have been approved through the FDAs we'll talk about, New Hampshire and other states have been preparing very quickly, moving to get ready to receive these vaccines. However, to set the stage for today, recent surveys indicate that, depending on which survey you look at, that about 50% of those polled are unsure about whether they will or will not take the vaccine. So that naturally has led employers to ask, can we require our employees to get the vaccine or not? As you probably saw in the news, on December 11th, Pfizer's COVID-19 vaccine was the first vaccine to receive the FDA's emergency use authorization. So an EU emergency use authorization, or EUA, is a temporary approval, not full licensure. Interestingly, the day before Pfizer's vaccine was approved, the FDA's advisory committee recommended the shot for those 16 or older. And depending on the vaccine, but looking at Pfizer, that vaccine is shown to be effective as much as about 95% effective, depending on which study you look at. On December 14th, the Pfizer vaccine was shipped coast to coast. And as you probably saw in the newspapers, there were many hospitals and other healthcare facilities around the state that had, showed pictures in the newspaper of their healthcare workers getting vaccinated. Interestingly, on last Friday, or I guess I should say in a timely manner, on last Friday, Moderna's vaccine was approved by the FDA. Similar to the Pfizer vaccine, Pfizer is a 2-dose, 21-day in between each dose. Moderna is 28 days in between each dose. But we now have 2 approved vaccines under an EUA and potentially 2 to 3 more in the pipeline, like AstraZeneca. We've all known that on day one, there wasn't going to be enough vaccine for everybody in New Hampshire. So the state, like most states in the country, put together a vaccine rollout plan, and that plan is underway. It's essentially a 4-stage plan. The first stage, as shown at the bottom of the slide here, deals with getting those crucial and critical healthcare workers vaccinated. There's about 60,000 of them in New Hampshire, 15,000 residents of nursing homes and assisted living facilities, and 13,000 first responders. We only got about 13,000 of the Pfizer vaccine in the first shipment, but as I understand it, more are on the way. So we will be in that phase 1 for a little bit now. And this is a more detailed explanation of the plan, which you can find on the New Hampshire Division of Public Health website or the DHHS website. We talked through phase 1A, which is long-term care, first responders. Phase 1B are older adults who are living in other group living settings, such as independent living facilities and senior complexes. And this phase also includes others who have conditions that put them at significantly high risk. Once we get through phase 1, we're into phase 2. So looking at school teachers and staff, childcare workers, prisoners, homeless shelters, group homes, and other seniors. Once we get through that phase, we're into phase 3, which is young adults and children and workers and other occupations important to the functioning of society and who may be at increased risk of exposure. And then after that, it's everybody else. So is everybody on board? As I already alluded to, depending on the study you look at, you'll see, 50%, 40%, 60% say they will or will not agree to be vaccinated. So I think it's fair to say about half of the country is uncertain as to whether they will refuse the vaccine or not. Now, as we talk through the numbers, it's estimated that about 21 million healthcare workers and 3 million residents of long-term care facilities could be vaccinated by the end of January. And as many as 100 million Americans could be vaccinated by March 2021. But in looking at some of the statistics and literature on this, it looks like in order to reach herd immunity, we're going to need about 70 to 80% of Americans that need to be vaccinated. So that's why you're seeing all the articles start to pop up now with, even if I get the vaccine, do I still need to wear a mask? And the answer is probably going to be yes for quite some time. So even once we hit that June 2021, to get there, I'd be interested, I think we'll all be interested to see what restrictions are still in place. So now I'm going to turn it over to Jim Reedy to talk through some of the legal issues around can the federal government mandate the vaccine, can state governments mandate vaccines, and while you're all here, can employers mandate vaccines? Jim?
Great, thanks, Jay. And thanks to everyone for being here today. I know it's certainly a very busy time of year with the holidays, a year end and the like. And I think also that the craziness of where we've been in the last 10 months. One of the things that we want to talk about as we're talking about whether or not there can be a mandated vaccine is, employers have this pressure upon them. They're frustrated by the absences, the furloughs, the shutdowns of the last 10, 11 months, and the absences of their employees. They've got labor shortages, but the tension is they want to keep employees safe, and they also want to retain their employees. One of the things that's come up in the last few weeks as a part of these surveys is if I'm required to take the vaccine, maybe I'll go somewhere else where they're not requiring it. So on. We've actually heard that from some clients that they're hearing from their employees. So let's take a step back here for a second. And can the federal government mandate the vaccine? Because a lot of this information is coming from the federal government, whether it's the president and healthcare advisors or others, the FDA, as Jay mentioned, and so on. Can the federal government mandate that individuals get the vaccine? And the short answer is no. Because effectively there's no precedent for that. Now, while this is an unprecedented pandemic, certainly, in 2014, the OSHA came out with their pandemic guide, which would have been around the time of H1N1 or SARS. And basically, even OSHA with their guidance, and their guidance usually tilts towards being super cautious and protecting the employees. They only simply encouraged employers to encourage their employees to get the vaccine, to get a vaccine to reduce the risk of infection and therefore to keep the workplace safe. EEOC, the U.S. Equal Employment Opportunity Commission, came out with guidance on this just last week, But even before that, EEOC's guidance, again, in response to the flu vaccine or H1N1 or SARS in recent years, said that a vaccine may actually be necessary in some jobs, but also had the carve-outs that we're all familiar with. Those carve-outs being medical, disability, or religious accommodations. So we'll talk about that. So in New Hampshire, can the state rather, mandate the vaccine? And the short answer is there is actually a state law with regard to certain licensed healthcare facilities, and Jay can talk about that in greater detail, where healthcare workers, those that are patient-facing, clinical workers and so on, or those in adult daycare, residential care and so on, could be required to have certain immunizations. And the focus typically is for the flu vaccine, but also titers and immunization records for MMR, measles, mumps, rubella, hepatitis, and so on. So there is a provision under state law for that. Now, there's been nothing that's come from the governor's office or the Department of Health and Human Services that is directing individuals in New Hampshire to get the vaccine. All they have is the schedule that Jay talked about, the 4 steps for rolling out the vaccine in New Hampshire. Going back to state law, however, there is a provision, even though certain employees in certain environments can be required to have the vaccine or show immunization, there are carve-outs still for medical, disability, or religious exemptions. So what about employers? Because that's what we're focusing on today. Can employers mandate the vaccine? And Jay referenced the emergency use authorization from the FDA. And in that, it talked about notice and the opportunity or the option to refuse the vaccine in that EUA. And I think that's important because that is a preview, and actually that is hand in glove with what the EEOC will be talking about as well. So on December 16th, just last week, EEOC issued guidance because they knew our webinar was coming up and they wanted to give us information that we could use. That's how closely tied we are with the EEOC. Kidding, but they issued guidance, and it was guidance that we anticipated. We actually were relying upon the guidance from the flu vaccine and otherwise that I referenced earlier. They came out and said, yes, indeed, some employers can indeed mandate their employees get the vaccine. And that is an important consideration. Now, what environments are we talking about? They didn't specifically say hospitals, nursing homes, assisted living, healthcare agencies, and so on, but certainly that's the direction that we're talking about, because what they're saying is it has to be job related. The requirement for the vaccine must be job related and consistent with business necessity. But even then, even those employers who may be able to mandate the vaccine for their employees have to proceed with caution. So what are we talking about? Again, we're talking about that the vaccination is job related and consistent with business necessity. What does that mean? That means that truly it is consistent with the person's performance of their job and what they're doing. It is tied to their essential functions of their job, and also consistent with the larger organization's business necessity. What is that? Again, drawing upon a healthcare environment, which I would defer to Jay in that regard. It's you're dealing with a clinical setting where you're back and forth and you're treating patients or you're assisting residents and so on. And there is a greater chance of exposure or contamination between employee and patient and so on. You also have to determine as the employer if the employee's refusal, if you're going to look at job related and consistent with business necessity, whether or not the employee's refusal or failure to get the vaccine represents a direct threat. That term is thrown around a lot, but we're going to talk about what that means. A direct threat to himself, herself, coworkers, or others in the workplace or in that environment. So in other words, not all employees, even in a healthcare setting, should be automatically required to get the vaccine. I mean, I think of one example, a an employee in a hospital setting that perhaps is in the accounts payable office, in a setting that is completely segregated from the clinical area. Well, you can argue in that case, if that person never travels into that area, perhaps. Again, I defer to Jay and his group in that regard. But let's talk about if the refusal is based on medical, disability, or religious reasons, is there a reasonable accommodation? And that is something as HR professionals, you're very accustomed to having that discussion, that interactive process back and forth, exchange of information. Can the person still, with a reasonable accommodation, perform all essential functions of the job? And that draws back to whether it's job related and consistent with business necessity. When the EEOC issued their guidance in December, just last week, what they said was, and it was important, they said the requirement of a vaccine, now whether by the employer or by the employer's agent, or simply that they say, go get a vaccine and provide proof. You have to be careful that that process does not elicit more information about the employee's current medical condition or general health than is absolutely necessary or relevant to that accommodation process or that direct threat analysis.
Jim, and I would say also, just to add in, also be careful about questions you're asking about the employee's family members. So you don't want to run afoul of any of those prohibitions as well.
Yeah, and a great point, Jay. And with regard to Gina, with regard to genetic information, but also Jay can talk about HIPAA as well, because there's, I think, and Jay, you'll appreciate this, I think there's a great misunderstanding out there as to the requirements of HIPAA in an employment setting. But certainly just what EEOC says was to avoid getting into discussions where you might discover about the employees, and as Jay's point, the employee's family, hidden disabilities or things that are not relevant to the discussion in the workplace. Keep it narrowly focused, which is you're required to have the vaccine or provide proof that you had the vaccine. Other legal issues are that employers need to provide notice. This comes from the EUA, but this also comes from EEOC's guidance as well, which is it's effectively knowing or informed consent of the known benefits and also the risks and side effects of the vaccine must be provided. And I know Jay and his group have actually worked on some sample notices and consents and things that, of course, we've been sharing with our clients. Employers, if an employee says, I cannot take the vaccine for these reasons, we'll talk about that in a minute. What are some of the accommodations? We'll talk about that too, but can you relieve the employee? This comes from the EEOC guidance. Can you relieve the employee of his or her job or have the person work remotely? The short answer is yes, and there are other accommodations too, but you cannot retaliate against the employee for refusing the vaccine. You'll walk right into a lawsuit in that regard. So Jay mentioned, should consent be required? Is it required rather, whether it's mandatory or voluntary? Should you have that notice and consent? And the answer is yes. In a union environment, mandating the vaccine certainly would be the subject of collective bargaining with the union representatives, and the vaccination records and related inquiries should be treated as confidential medical records. So let's talk very quickly about the ADA part of it. If the person identifies and says, because of my medical condition, meaning there could be side effects or allergies and the like, we've heard some of that in the news already, or because of a disability. What is a disability? It is a physical or mental condition that has the effect of substantially interfering with a major life activity. Because of those things, I cannot take the vaccine. So again, the vaccination must be job-related, consistent with business necessity. At the person's refusal, you have to determine whether or not that is a direct threat. We'll talk about that a little bit more in a second. But the discussion should be no broader and no more intrusive than necessary. And again, when applicable, whether we're talking about religious accommodation or medical or disability, you have to go through that reasonable accommodation analysis. I want to talk about that now. So under Title VII, which is Title VII of the Civil Rights Act of 1964, as amended in 1991, this question has come up a lot. But with regard to, can an employee refuse, and in this case, refuse the vaccine on the basis of the sincerely held religious belief? Underscore sincerely held religious belief. Not that I sort of generally believe, or I'm objecting generally with regard to, I don't believe in vaccines and so on. It has to be that your religious tenets, the things that you sincerely believe, are at conflict with this job requirement. In other words, the vaccine requirement. Now, in that regard, does the person have to say, I've attended church for X number of years and so on? No, but the employee must still say, this is why I object. And then there's a discussion back and forth. And the discussion is not on how religious are you, or let me quiz you on the Bible, or otherwise. It is simply going to be, okay, let's talk about that. Let's talk about what that means and whether or not you can still perform your job. So the obligation is that you accommodate unless it represents an undue hardship. What is an undue hardship? It's more than just a minimal burden, but it's an easier standard than under the ADA. So under the ADA, you have that discussion of, can you, that you're going to agree to the vaccine, and the person says, I can't because of my disability. You engage in what I referred to earlier as the interactive process. And it's basically, it's reasonable until it's not. And what is it not? An undue hardship. But what is an undue hardship? The cost and effect upon the organization. And add one more to it, and especially in this environment, no vaccination represents a direct threat to the unvaccinated in the workplace. And again, in the union environment, we're going to have discussions about, because these are terms and conditions of employment, whether or not, or how that's implemented through management rights or otherwise. But I'm going to turn it back to Jay now with regard to that discussion, that reasonable accommodation discussion.
Thanks, Jim. So you had alluded earlier to the question about, is consent required? And under the FDA's EUA, the answer is yes, as you mentioned. And in the context of if you're going out to actually get the vaccine, you will get what's called a patient fact sheet or drug fact sheet that actually lists out all of the potential, benefits and risks associated with receiving the vaccine. And I think you mentioned, Jim, that we've been assisting some healthcare employers with their own policies around this issue and consent forms. And I think one trap for the unwary is just making sure that you do not decide on your own to come up with what you see as the risks and benefits and try to recharacterize them. Leave that to the professionals who studied the risks and benefits of this. But I think the important piece is that it's voluntary, because the EUA requires it to be right now. And then also listing clearly the consequences in the case of opt-out. Because I think if I'm an employee, I'm going to want to know, okay, what happens if I say no? As Jim mentioned earlier, healthcare facilities in New Hampshire often require staff to get, and in other states, require staff to get the flu vaccine, hepatitis B, MMR, varicella, Tdap, for the safety of their patients. Obviously, healthcare professionals who are patient-facing work in an environment where they have contact with patients, they have contact with infective material. So the healthcare workers are at risk of themselves contracting viruses and transmitting them. That's why vaccination programs are deemed an essential component of infection prevention and control. And that's why the state has codified some of these vaccine requirements in law. So I'd be very interested, as Jim mentioned, to see whether the legislature or the governor or DHHS takes some steps to actually legislate this in the future. I don't think that'll happen until we get full FDA approval. But, I know we talked a lot about statistics, and any article you read will tell you different things, but I found it very interesting when I dug into this topic that in a survey by the American Nurses Association, I know this was back in October, so this was, a little earlier, things have gotten worse, but still among nurses, only a third said they would definitely get it. A third said, maybe I'll get it. And a third said, I'm not sure. And I think, as mentioned at the bottom of the slide, there was a lot of literature about physicians and nurses actually waiting to see the side effects of vaccines and waiting for full approval under the EUAs before themselves signing up to get it. That's not all of them, obviously, but some of them. And according to an article from the American Hospital Association, hospitals are unlikely to mandate the vaccine until full FDA approval. That's likely because we've talked about there's that caveat in the FDA EUA about it needing to be voluntary. So Jim alluded to this already. I get questions all the time about HIPAA's application to employers generally. Generally speaking, I'd say probably 99% of the time, if you are a garden variety employer, you are not a covered entity under HIPAA. Under HIPAA, you're a covered entity if you're a health plan, a healthcare clearinghouse, or a healthcare provider who bills insurance electronically. Even if in the context of being an employer, you receive some otherwise HIPAA protected PHI, protected health information, that does not magically convert you to a HIPAA covered entity. And the COVID-19 vaccine does not change that. And with respect to GINA and the EEOC guidance, they get into it. There's a number of FAQs on GINA, so I'd recommend you take a look at that. But the high level point is Title II of GINA is not implicated when an employer administers the vaccine or requires employees to prove that they've received it, because those acts do not involve the use of genetic information to make employment decisions or involve the acquisition or disclosure of genetic information. So quickly, in the interest of time, I just wanted to delve a little bit deeper into the EEOC's direct threat analysis, as Jim hinted to earlier. This really requires, as all you HR professionals know, this involves conducting an individualized assessment of the following 4 factors to determine whether a direct threat exists: the duration of the risks, the nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of the potential harm. And, in the EEOC guidance, they essentially say, generally speaking, COVID-19 does present a threat, but you need to look at whether there's any reasonable accommodations, as Jim talked about at length, that wouldn't provide undue hardship, that would eliminate or reduce the risk for the unvaccinated employee. So you really have to consider alternatives. Can we move this person to remote work? Can they continue to operate with PPE? Can we move them to a different site of service? Is there any way to allow this person to continue to do their job functions and accommodate them? Consider the CDC guidelines, OSHA guidelines, and any other sources that are out there in order to make that determination. And we talked about these alternatives, and I think just to make sure I cement that point, if you can't give a reasonable accommodation, then the EEOC guidance is clear, as Jim mentioned, that you can prevent the employee from coming to the workplace and possibly even terminate them. So you should be thinking about these different alternatives and trying to make that determination of whether a reasonable accommodation is possible. Termination should be the last option, especially now when we're under a voluntary EUA from the FDA. So I'll turn it over to Jim for the last few minutes of best practices, and then we'll turn to questions.
Thanks, Jay. One of the things I wanted to say at the outset as we were getting this program together, one, I'm thrilled that we were able to put it together in, given the guidance was just last week and how things are rapidly developing. And of course, now Moderna is the next vaccine out, and there could be as many as 3 more, and even being developed here in New Hampshire, which is amazing. Truly, we are at a position of the light is at the end of the tunnel, but lots of work ahead. But I also want to give kudos to Jay Gregoire and his healthcare group. Jay is certainly one of the leading healthcare lawyers in the state, and I rely and other people here in the firm, of course, too, rely very heavily on Jay's advice and guidance on this issue. There's lots to be done, and I think we're going to see a lot of it in the healthcare area, but perhaps expanding out from there with regard to the vaccine. So stay tuned. Best practices in this area. Really, if you look back to March, and March seems like so long ago, but a lot has happened since March of 2020 with regard to the evolution of the virus, but also how the law has responded, how employers have responded, and so on. And it's amazing that we're at this point of a vaccine, but still, employers and others are proceeding with caution. So stay up to date with CDC and New Hampshire HHS guidance. Create or update your COVID policy. And what does that mean for your workplace? If you are going to require vaccination or proof of vaccination, including that in your COVID policy. If you don't have a COVID policy, certainly reach out to us and we can assist you in that regard. But COVID policies are everything from workplace safety issues to the inquiries, the daily inquiries of your employees and so on. The notice and consent part that Jay spent time talking about, I think is very important here. Of course, it comes from the EUA, but also just it's a required process that you go through if you are requiring the vaccination or having a third party do the vaccination. The EEOC guidance talks about that as well. Continue to follow your workplace safety policies. There's no question about this. While Jay talked about surveys, the surveys out there are basically saying that while there is a light at the end of the tunnel, people have COVID fatigue, so they're relaxing. Or once they know that some people have the vaccine, they're going to stop using PPE and so on. Health professionals say that is a bad idea. While by the end of February, we could have as many as 100 million Americans having received the vaccine. We're a country of 325 million Americans, and it's going to take, I think as Jay mentioned, till late May, early June for 70% of Americans to be vaccinated, if that is possible. So continue to enforce your workplace safety policies, certainly through the first half of 2021. If vaccination is required or encouraged, be careful to avoid improper or irrelevant inquiries. That's where employers get in trouble when they ask about things, whether it's hidden disabilities or, as Jay mentioned, family conditions and the like. Let's stay focused on what the requirements are for the vaccine, and it has to be, again, job related. Engage those employees in the interactive process, and that isn't, the bad boss in every organization says, because I said so. That's never a good idea. Again, people are nervous about the vaccine, but they're nervous about the virus. I think anytime there's a requirement, it has to be, be job related, but if it's, there is a reason for a need for an accommodation, having that discussion. And remember, part of the accommodation process, it's not just what the employee or his or her physician says, it's a back and forth. And with that, again, and the ADA, cost and effect upon the organization, as long as it doesn't represent a direct threat. And in the religious accommodation, it has to be a sincerely held belief, but it has to be above the nuisance level for employer for purposes of saying no. And then maintaining confidential medical records. The ADA talks about that, to keep those segregated in personnel files and so on, and be as flexible as possible. The governor talked about that with regard to sick leave policies. It's certainly recommended by the CDC and as a part of the FFCRA. Be as flexible as you can. You want to keep employees safe, and there's no question brighter days are ahead, but in the meantime, stay vigilant and stay safe. So that's what we have for our time for the substantive part of the presentation, but now we're into the questions. And Jay, I'll take the one that's just popped up here, and actually there are two related. Can an employer provide incentives for the employees? So we're not mandating it, but we're providing an incentive to get the vaccine. And can we pay employees to get the vaccine? The EEOC doesn't say you can't do that. And the question is, sure, it's something more than what the employee would receive. You could do that. I think there might be other incentives as well. But again, the same question or the same issues come up. One is consent, truly knowledgeable consent, knowing consent, and the opportunity to opt out. So I think that you want to look at that. You always want to consider, what am I going to do should someone say no or they question this policy? Other incentives could be providing an opportunity for the vaccination on site, just like a flu vaccine. Also paying the employee for time taken to go off site for the vaccine and so on. That's entirely possible. Another question that came up was with regard to hazard pay. An employer presently provides hazard pay to employees working during this pandemic. Can they revise that for those that receive the vaccine? I think you have to be careful in that regard because you're already providing to the frontline workers. Perhaps you want to provide an augmented hazard pay or incentive. But I think going back to the beginning, I think explaining clear communication to employees of the need for it in certain jobs, and with that, I think should go a long way. And I think also we're now just a week into the vaccine rolling out. We know of some side effects. I think, as Jay said, the more we know about that, perhaps people will be less reticent about receiving the vaccine.
Jim, I can tackle a few quick questions if you'd
Sure.
like. One of the questions was, when is full FDA approval expected? The articles I've seen have said the March, April timeframe. Those are predictions, but I think that's what we're all waiting for. Another question was, if we're a healthcare provider and receive the vaccine, if those qualify for exemption, can we require them to wear masks? And I think the answer is yes, just like you have been all along. And it goes into that reasonable accommodation discussion that we've had. You know, you want, if somebody's going to stay and they qualify, you know, you want to make sure that the workplace is safe. Another question was, if someone doesn't get the vaccine, are differential practices permitted? I think that's a related question. I.e., you know, they had asked about different regulations, stickers on badges. I think, again, it's all related to that reasonable accommodation. How do you keep the workplace safe, but also, you know, make sure you don't run afoul of the ADA or the EEOC guidance.
On that last one, Jay, I want to ask a question. In a healthcare setting, the question about stickers, badges, and the like, there was a question that came up last week as to whether or not once someone gets the vaccine, should they be required to wear a different color mask to show that they've had the vaccine? I'm a little nervous about in a workplace setting about badges, and it's almost like the scarlet letter.
Yeah, right. Yeah, you know, everybody else has the yellow mask on, but I have the red mask on. That's not going to. That's a discriminatory practice. Yeah, I would be leery of that.
Yeah. So to quickly review, because there was another question about reasonable accommodation. Again, as Jay said, it's an individualized assessment. What does that mean? It's unique to that individual, their particular circumstances, not what someone else may have done before. And there's a myriad of possibilities out there. It's remote work. It's segregating the person to work in a different department. It's the possibility of leave. It's the possibility of split shifts, perhaps furlough. The very last resort would be termination. But there could be instances where in certain settings and certain jobs, a person not getting the vaccine or not getting vaccinated rather, represents a direct threat to themselves, to coworkers, and to the people that are in their workplace with them. And they may be in a position where they cannot perform the job, at least for a period of time until this crisis passes.
Yeah, there's an interesting question that came in about, will airlines and other types of transportation companies require the vaccine? And I think that's an open question, because I did see an article in the New York Times about that very issue this weekend. And you may see this race to airlines wanting to declare themselves the safest airline to fly on. But I think that's to be determined.
Any other questions, Jay, that you want to tackle, as far as I know time is short here today?
Yeah, just one more question here, Jim. I thought this would be an interesting one to talk through with you. The question is, if an employer non-healthcare has been fully open for business all the way along, doesn't that pretty much take away the defense that we can't reasonably accommodate employees who refuse? Meaning, I've been here since March, I've been wearing PPE, I'm fine. You know, what do you think about that, Jim, in terms of reasonable accommodation analysis?
Yeah, it's a good question, and I did see that, and I think that that has come up a lot, even apart from this webinar today. And the PPE has, I mean, and specifically face masks, have their certainly value, but compare that to the vaccine, which has 95%, at least that's what the stated efficacy is, 95% effectiveness. Then that is even more so effective, because we see the statistics out there that even with PPE, the numbers continue to rise. So I think to the extent that a vaccine is available, and again, it could be required in that workplace, that is one that takes, I think, take precedence over just PPE alone. But that goes back to, if I refuse the vaccine, when it is job related, can I just wear a mask? And the answer is, it depends. It depends upon the job. It depends upon the environment. It depends upon the business necessity. So again, it's an individualized analysis in your workplace, and then down to the micro of that job. But there'll be more on this. And like you've seen, if you've seen the FAQs from the Department of Labor since March, it evolves constantly, and we're going to see more and more on that. But for now, I think you're on solid footing with regard to where the law is and what your options are as an employer.
Yeah, we'll keep you up to date. There's no doubt we'll be doing a round 2 on this at some point. I mean, even trying to prep for this webinar, as Jim mentioned, we had the EOC guidance drop and a new vaccine be approved. So rest assured, we'll keep abreast of the developments and keep you abreast of those developments.
In the meantime, folks, thanks for being here today. Brighter days are ahead. Stay vigilant, and happy holidays. Thanks, Jay.
Thank you,
Thanks,
Jim.
Paul.
Thank you, everybody.